Maternal mortality rates are increasing worldwide naman siya, not only in the Philippines, but because the Philippines is a third world country, I think our maternal mortality rate is higher than other countries which are first world, mainly because of the healthcare system in our country and also the lack of awareness and education of our patients regarding their maternal health. Couples should be aware of the rising numbers of maternal death. First, mainly because of the personal risk. So any woman who is capable of carrying a child, they are at risk of developing pregnancy complications. Another reason why couples should be aware of the rising maternal deaths is because of the impact on the family. Because if the mother dies during childbirth or after delivery, because some complications develop even after delivery. So the impact on the family, the emotional stress on the husband or on the family, the care of the newborn and also the other children that the mother left behind, and also the financial strain on the family. So it's very important that couples are aware of this rising maternal deaths. Another thing is these maternal deaths, the causes of this are actually, some are preventable. So if couples are aware of the rising maternal deaths, they can educate themselves or they can also advocate for themselves to be more healthy and to plan their pregnancies. And while they're pregnant, they can obtain the proper obstetric care, prenatal care. They should be educated on the availability of the health services that are available to them. First would be the personal risk of the mother, as I've said before. So if the mother already has pre-existing conditions prior to the pregnancy, those conditions can exacerbate during pregnancy or they can worsen during pregnancy, especially if they're not taking good care of themselves, they're not seeking obstetric care. And then another would be if they already had previous conditions or previous complications on their previous pregnancies. So there are conditions in pregnancies that could increase the recurrence risk for the present pregnancy. Another would be the age. Just maternal age alone is also a risk factor for developing complications, especially those more than 35 years of age. Since those 35 years of age, as we know, that's already high-risk pregnancy just by the age alone, because they are more prone to developing hypertension, diabetes, kidney diseases, and even it's usually extremes of age, so more than 35, and then on the other end of the spectrum, those that are less than 18 years old, those teenage pregnancies. But the trend now is there are more women that are getting pregnant after 35 years of age, because the generation now, or maybe the trend now, is more of career-oriented women. So less than 35 years old or 35 years of age women, they focus more on their career. And then after, they focus on family building after 35. And with the advent of technology now with IVF, so more women who are more than 35 years old are getting pregnant. If a patient is pregnant, they should have regular prenatal checkups so we can assess their risk to develop complications. Because in the outpatient department or in our clinics, even in the private clinics, we screen our patients regularly. We screen their vital signs if they're hypertensive. We screen their sugar monitoring. So we screen their risks based on their personal history, personal obstetric history, as well as their family history, because familial diseases could also affect pregnancy. First-time moms, my advice is that they should have prenatal care. On the first time that they learn that they are pregnant, on the first pregnancy test, they should already seek obstetric care, whether it's in a lying-in with a midwife or with in the hospital with an obstetrician. They should go to the hospital for prenatal care. So it's very important to have your obstetrician know what you need at the moment or what your concerns are. So for the prenatal care, we usually advise patients to have follow-up every month, until the third trimester, and then every 2 weeks until she delivers. So the timing of prenatal care is very important because every prenatal care, we analyze the patient's condition. If there are any risks to her or to the baby, we can evaluate and we can give timely management. Here at MakatiMed, we have several obstetricians and as well as subspecialists. We have high-risk pregnancy specialists, or like myself, I'm a perinatologist. We cater to high-risk pregnancies. We also have obstetricians who are subspecializing in infectious diseases. Like pregnant women who have infectious diseases can also be referred to them. We also have other obstetricians like oncologists, because there are also some pregnant women who have cancer while they are pregnant. So we also have oncologists, obstetricians that we can refer to. And then aside from that, we also have the general obstetricians helping us with our patients.